I'm Hugh Morse.
I'm Giovanni Mary. I'm Melanie Cummings.
The purpose of this presentation is to talk about cancer. In this presentation, our group will show you what cancer is scientifically, give examples of a few common forms of cancer, and provide tips on how to reduce the risk of cancer. What is cancer? Cancer is a term used for diseases in which abnormal cells divide without control and are able to invade other tissues. Cancer cells can spread to other parts of the body through the blood and lymph system. Cancer is not just one disease, but cancer is many diseases. There are more than 100 different types of cancer. Most cancers are named for which the organ in which they start. For example, if a cancerous cell starts in the lung, it's called lung cancer. If a cancer cell starts in the colon, it's called colon cancer. There are 5 main categories of cancer, okay? We have the carcinoma stage, the sarcoma stage, the leukemia stage, the lymphoma and myeloma stage, and the central nervous system cancers. Okay. The carcinoma stage is cancer that begins in the skin or in the tissues that line or cover internal organs. Sarcoma stage is cancers that begin in the bone, cartilage, fat, muscle, blood vessels, or other connective supportive tissue. Leukemia is a cancer that starts in the blood-forming tissue, such as bone marrow, and causes large numbers of abnormal blood cells to be produced and enter the blood. The lymphoma and myeloma stage are cancers that begin in the cells of the immune system. The central nervous system cancers are cancers that begin in the tissues of the brain and the spinal cord. Well, to understand cancer, you have to understand cells. It's helpful to know how normal cells become cancerous cells. The body is made up of many different types of cells, okay? These cells grow and divide in a controlled way to produce more cells as they are needed to keep the body healthy. When cells become old or damaged, they die and are replaced with new cells. However, sometimes this orderly process goes wrong. The genetic DNA of a cell can become damaged or changed, producing mutations that affect normal cell growth and division. When this happens, cells do not die when they should, and new cells form when the body does not need them. The extra cells may form a mass of tissue called a tumor. There are 2 types of tumors. You have the benign tumors and the malignant tumors. Benign tumors aren't cancerous. They can often be removed, and in most cases, they do not come back. Cells in benign tumors do not spread to other parts of the body. Malignant tumors are cancerous. Cells in these tumors can invade nearby tissues and spread to other parts of the body. The spread of cancer from one part of the body to another is called metastasis.
I'm going to talk briefly about 4 types of cancer. First, I'm going to talk about skin cancer, which most often develops on skin exposed to the sun, but it can also develop on skin unexposed to the sun as well. There are 3 major types of skin cancer: basal cell carcinoma, squamous cell carcinoma, and melanoma. Prostate cancer. Prostate cancer is cancer that occurs in a man's prostate. It usually grows slowly and initially remains confined to the prostate gland, where it may not cause serious harm. Some types of prostate cancer grow slowly and may need minimum or no treatment. Other types are aggressive and can spread rapidly. My last type of cancer I'm going to talk about is the most common cancer, which is breast cancer. It's cancer that forms in the cells of the breast. Usually the first sign of breast cancer is often a breast lump or an abnormal mammogram. Breast cancer stages range from early curable breast cancer to metastatic breast cancer, with a variety of breast cancer treatments. Breast cancer mostly occurs in women, but it can also occur in both men and women.
talking about cancer prevention. Now, there is not one clear cause for cancer. However, there are preventive measures that you can take so that you don't get cancer. First of all, is tobacco use. In 1957, the Surgeon General declared the U.S. official position that there is a causal relationship between lung cancer and cigarette smoking. And this was back in 1957. In 1970, they actually banned all cigarette commercials. However, we still have cigarettes on our shelves. So it is in our hands to control our own health and to stop smoking cigarettes. In 1957, the Surgeon General directed a direct cause between cigarette smoking and lung cancer. Actually, in 1970, they banned all cigarette commercials because of this correlation. However, we are still selling cigarettes and still able to purchase them in the stores. So our health is in our hands as far as smoking cigarettes. The different ways cigarettes can affect you, it can give you kidney cancer, lung cancer, bladder cancer, and all of the types of cancers that cigarette smoking cause have not been identified, but those are of the main sources. Other ways that we can prevent cancer is protecting ourselves from the sun. Please avoid sunlight between the hours of 10 a.m. and 4 p.m., where that would be the most deadly rays. But overall, just also always make sure you have sunscreen and also always stay protected. It's also important that you avoid risky behaviors. That means practicing safe sex and also not sharing needles. Although having, unprotected sex is not going to cause cancer, having diseases, STDs, STIs, HIV, you're basically opening a window in your body to attack on your immune system. And lastly, just get regular medical care. A lot of times people can have cancer and it could go unnoticed. So just also, especially if you're a woman, get your mammograms. If you're over the age of 22, you should actually get checked yearly.